Hello and welcome to another interesting edition of Health Watch, reaching you on the station for Excellence NTA Lagos Channel 10. Today on the program, our focus is on eye care. In fact, that is one valuable sense organ that gives us the ability to see. Our doctor in the house today, Dr. Adetunde Anifaleye, will be telling us all we need to know about how to take care of our eyes and how frequently you should go for an eye examination. Plus, we have a feature on high blood pressure. You agree with me that COVID-19 has had a lot of effect on businesses and the economy, and people are going through a lot right now. But not to worry, Health Watch is here to give you all you need to know about how to take care of your blood pressure. All this and more on this week's edition of Health Watch. My name is Nkem Okibe. We'll go on a short break. When we return, you'll meet my guests. Stay with us. My name is Nkem Okibe, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by a pharmacist because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervix, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it should been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch. If you're just joining us, the program is Health Watch, and like I said before we went on the break, our focus today is on eye care. My guest today is a fellow of the Nigerian Optometric Association and a life member. My guest today is Dr. Adetunde Anifaleye. You're welcome to the program.
Thank you.
Talking about the eyes, that's one organ that once you look at the face of anybody, you just want to, the eye captures, as in it captivates you, especially if it's a beautiful eye. Now, what is the importance of eye care?
Eye care is very, very important. In fact, people and the government and the society have not given the right priority to it as it should be. 80% or more of perception have to do with sight. Mm-hmm. Again, a good sight is necessary for any athletic work, for driving, for learning, for acquiring any learning. You need a very good eye. We also know that poor eyesight is correlated to poverty and the poor economy. Poor eyesight also fails on the self-esteem of the person involved. Poor eyesight also makes a person not have authority. It loses authority even to the children. Remember the case of Esau and Jacob, when Jacob was able to deceive the father just because of the poor sight. So one tends to lose even authority over his children, wife, husband, and other things. And economically, you find that most people who are partially blind or blind depend on others for care, for taking care of them. And those who take care of them, some are children who ought to be in school. So they have been deprived of their schooling. Who knows, some of these children would have been those who could have pioneered certain things that would have brought us out from our present economic downturn. Many of these things that lead to blindness or partial loss actually are avoidable or treatable. So if government could put in enough resources to the prevention and care of eye. Both it will enhance our economy, it will enhance our productivity. Many accidents that takes place are caused because of poor eyesight, and those economic losses could be reduced. So on the whole, eye care is very, very important.
So what are the common eye problems you find in this climb?
Well, the common eye problems, which you also may know, is that the number one is refractive error. Almost 90% of the society have one type of refractive error or the other, which need to be corrected. You also have macular degeneration, mainly among the elderly people. Then you also have glaucoma. It's always headed. You have cataract. Then you have injuries, brain injuries, other injuries that may affect the eye. And there you have things like amblyopia. You have so many things that can affect the eyes. The conjunctivitis, which you call pink eyes, and all this. These are common things that we find daily.
For the first one, refractive error.
Yeah.
What would you say are the major factors? Because you find a family where the father, the mother, and perhaps they have 6 children. All of them are wearing glasses.
Yeah.
What could be the factor responsible? How can it be prevented? Because I wouldn't want my children to wear glasses. I also wear glasses too.
Refractive error, apart from it being hereditary, one should understand that just like every other part of the body grows, the eye also grows. And for the eye, the growth are very specific. Once there is a difference of even 0.001 millimeter, it alters the whole refractive state of the eye. So it's not actually a big deal that all the members of the family have refractive error.
Oh, you think so?
Yeah, it's not a big deal. It's not a big deal. It's just
so
that
it's not a big deal for you to see a picture, a picture frame of a family, and all of them are wearing glasses.
Yeah. In fact, everybody, one time or the other, everybody alive, one time or the other, we need one type of corrective glasses or the other, because normally as you are growing, the old eye, just like all this thing, there are gradual changes. And at a point, what you used to see far, you cannot see very well. What you used to see near, you cannot see very well. So what refraction really do is to give you something that neutralizes the defect.
Okay.
So everybody need one type of assistant or the other in order to see clearly.
All right, doctor, let's go on a break. When we return, you'll be telling us the kind of foods that we should eat so that we don't fall into the category of people that wear glasses. Because I know that for everything out there, for every illness or every disease out there, there's some kind of preventive measure. So when we go on this break, when we return from this break, you'll be telling us the kind of healthy foods that we should stay on to ensure that we have good eyesight and that kind of bright eyes that everybody wishes to have. Okay. All right, we'll go on a short break. When we return, Health Watch continues. Stay with us. Welcome back. If you're just joining us, the program is Health Watch, reaching you from the station of excellence, NTA Lagos Channel 10. And my guest is in the house, Dr. Adetunde Anifaleye is an optometrist and a fellow of the Nigerian Optometric Association and a life member also. Okay, before we went on the break, you talked about refractive errors, and you were able to explain to us why at some point in life you need to get the glasses. And I also gave that illustration where everybody in the family is wearing glasses. And I'm beginning to I wonder, there should be some kind of preventive measure. There should be some kind of food you should stay on to ensure that you don't get to that level where you must have a spectacle.
Yeah, there are things we can do to minimize the effect of poor vision. But there's nothing we can actually do absolutely to stop people from having refractive error. Now, foods that are rich in carotene, like carrot, and other yellow colored foods are very useful in the eyes, because the eye, the visual cell itself is made of carotenoid. So when you are taking this food, it helps to enrich them. But we also know that we live in the tropics, and some people live by the waterside. Some people work in places where they use infrared, ultra, different type of things that use different wavelengths. Okay. So one way of protecting the eye, especially in case of cataract and some other diseases, is by using protective lenses. You know, the lenses we wear protects the eyes up to a point, but further researches have taken place whereby we found that there are other lenses that will help us reduce some of the more harmful wavelengths into the eyes. So we have today things like anti-reflect coatings on the lenses. Okay. We have blue light protectors. We have anti-scratch. We have different type of lenses. So one other way of protecting the eye, especially for those who work in hazardous areas, who use UV lights and other things, is to wear, even if you don't have a major refractive error, make sure you have an examination and get a proper goggle, a properly treated lenses to protect your eyes against those harmful rays. For instance, let me just mention one. You find that people who, fishermen and people who work, whose business are mainly on the waters, a good number of them have cataracts because of the wavelengths that their eyes are always exposed to. Okay. And it's the same thing with other professions. They have different hazards. So if a proper protective glasses are worn, in a way, it can protect them. And then also there is time the government tried to encourage giving people vitamin A. You know, it helps. And some other supplements. Starting from 40, we expect to have some supplements that are peculiar to the eye, that enhances the macula to function properly. So if you get to any eye specialist, he'll be able to recommend or dispense to you some of those supplements that can help you.
So you talked about eye examination.
Yeah.
So how often should we examine our eyes? And I'm sure that you brought this to make some kind of illustrations with it.
Oh, okay. Yeah. To ask how often we need to examine our eyes depends on the state of the eye. For an eye that have done full eye examination, you know, people normally talk of eye tests. I better bring in this in. People talk about eye test, eye examination. There's a difference between eye test and eye examination.
Please tell us.
Eye examination means comprehensive eye examination, whereby you look at this is a model of the eye. Okay. When you are doing an eye examination, you examine the external, then with that your ophthalmoscope, when you look in there, this is the pupil, the opening place. Is another. When you look in there, you'll be able to see all. In fact, the eye is one area that enables you to see what happens in the whole body. Wow. Now, you see, when you look in there, you see things like this, right inside. So, an eye examination will take you, not only the external, will take you in to see what is happening there. To see, this is the optic disc, okay, where if you have glaucoma, this is the first place that you notice. Also, if you are hypertensive, you can detect it here. If you are diabetic, you will see some floppy areas around this. So an eye examination will enable you enable the practitioner, even if you cannot ideally say this is exactly what is happening, to have an idea on what is happening and send you to the appropriate lab for the test or to other specialties for treatment. Eye tests, in most cases, is just coming in and they put some glasses. Do you see? Do you see? Do you see? Do you see? They give you a glass and you go. That is just eye test. But eye examination involves looking holistically what happens to the eye and then making it. Glasses may be one of the case. Drugs may be one of the supplements may be the other. Referral may be there. You may be asked to go and do some other specific tests. Like you can go and do CVF, OCT, you can do many other tests. You can do outclass scan to see whether there's any growth and so on. So eye examination is more than just that. So now coming to your question, how often should one examine eyes? Yes, ideally everybody should have his or her eye examined once a year. Okay. But if it's detected during the examination that you have some diseases like glaucoma, you may be asked to come monthly, quarterly, depends on the level at which the pressure is.
Well, thank you so much, Doctor. You've said a whole lot. But I'm so excited hearing this from you, and knowing that we brought you an optometrist on Health Watch this week. All right, very quickly, in just 30 seconds, what's your final word to all Nigerians and everyone that's watching right now?
What I would like to tell the generality of the people is that eye care is very important. Without the eye, you can't have a healthy brain. And if you don't have a healthy brain, you can't have a healthy living. So it is very, very important to have good eye examination, not eye test. Secondly, the government at all levels should put in as much fund as possible in the training of eye personnel. Also, availability of instruments and helping those who are one way or the other need assistance to prevent them from getting blind so that they can contribute positively to the economy.
Wow. We've been speaking with Dr. Adetunde Anifaleye, an optometrist and a fellow of the Nigerian Optometric Association and a life member. Thank you so much for coming on the program.
Thank you. It's a pleasure.
Moving on, our next feature is on high blood pressure. You agree with me that COVID-19 has put a lot of pressure on businesses and even on individuals. And as a result of that, people are very conscious of their blood pressure. Today on the program, we brought you a feature on high blood pressure. Enjoy it. We'll be right back. Everyone needs medical checkup to stay healthy. The basic routine checkup includes checking your blood pressure, pulse rate, sugar level, and your weight. A person's blood pressure could be high, low, or normal, and this defines your health status. When it is high, it could be a warning sign of a health condition.
High blood pressure occurs when the heart pumps blood at a high pressure level, maybe due to resistant arteries or narrowing of the arteries. It's usually said to be a silent killer, hypertension, because most times people might have high blood pressure, dangerous levels without knowing, and suddenly before they know it, it causes something sinister.
Medical experts say having a high blood pressure is a big health risk. This could have been triggered by some factors.
We talk about stress. There are factors like smoking, factors like being overweight or obesity, lifestyle changes, lack of exercise. Certain drugs too can predispose one to having high blood pressure. So most of the time we just look at different things. Even our age, as we grow, we find out that the pressure tends to be on the increase. Our race, because it tends to be higher to even with blacks. But most of the time we talked about people, those who drink a lot, high intake of alcohol, high intake of sodium, salt in the diet. Those are things that make one become more prone, to having high blood pressure.
High blood pressure can be genetic. Most times people who have high blood pressure, is observed that in their family history or tree, someone may have had high blood pressure, and that's why we like to probe through the genetics to know if anyone else had it.
With the pandemic, which has reduced the physical activity of people due to some of the lockdown measures made by the government, plus the adverse effect it's having on the economy, these could also have an influence on people's blood pressure.
Yes, someone asked, has COVID-19 pandemic contributed to high blood pressure? Indirectly, maybe because people were more indoors, not doing active physical activity, so it could increase their chances. But COVID-19 has no direct correlation with hypertension. So if you are not hypertensive, COVID-19 is not likely to give you hypertension.
Different people view the pandemic in different ways. To some workers, it's been an advantage for them to rest. To some other people, it creates tension because financially, they're not getting things. So in one way, for those who are, who have seen it as a period of rest, first of all, certain people, yes, they may have relaxed, but the relaxation may have made some people to become overweight, and some people do not exercise, and so that again may predispose people to having, an increase in their blood pressures. But by and large, the effect of it, sincerely speaking, because we are all here in the nation, economic-wise, it is telling on a lot of people. There's anxiety of loss of job. People have actually been sent away from job, from their working places, so the source of income goes down. So stress level increases.
High blood pressure, which can also be called hypertension, can cause many complications. If not controlled, could lead to disability, poor quality of life, kidney failure, stroke, or even a fatal heart attack. But all these can be prevented.
There's something that's presently is called a DASH, dietary approach, to stopping hypertension. A lot of our people eat too much salt, and we want to encourage people that they should reduce their salt in diet. You get to the supermarket to pick up things, it's far better you look at the label and see the sodium content, because the salt, we talk about sodium. Sodium should be reduced while we look for fruits and other foods that can increase potassium.
Make sure you are physically active, eat balanced diet, do exercises, visit the doctor to know your numbers, and generally stay healthy.
It is advised that you check your blood pressure regularly. Remember that prevention is cheaper and better than cure. And that's the much we can take on this week's edition of Health Watch. Remember that health-conscious people live longer. COVID-19 is not a hoax. Take responsibility and stay safe. If you must go out, mask up. Avoid crowded places. And regularly wash your hands with soap and water. In the absence of this, use an alcohol-based hand sanitizer. For inquiries, questions, send them to okibinkem@gmail.com or NTA Lagos Channel 10@gmail.com, or send a text only to 0706086547. Thank you for being part of this week's edition of the program. My name is Nkem Okibi. See you next week.